The
And
broadcast is now starting. All attendees are in listen-only mode.
hi, everybody. This is Kara with Senior and Disability Services, and I'm happy to have you here with us for our Care Coordinator monthly outreach. Just wanted to go ahead and welcome you. And I am the only staff member here today, so it's all good. I just have one thing to go over on our agenda. Maybe two things, but I'd really like to get your questions and, I can route them for answers if I can't answer them right away. Um, and just check in with everybody and see how you are doing. I know I've been sending some helpful info emails out to you, and that's kind of an easy way for me to get the word out to you quickly about what different procedures and things to know that are sort of up to date. And anyway, I will go ahead and share my screen. And if you would please just feel free to write into the chat area if you have any questions at all or any thoughts whatsoever. Um, and I'll be happy to share them, read them out, and we can discuss anything that you bring up. I know we have an entire hour set aside, and we may or may not use that, but that's okay. Any which way is fine with me. So I am going to share my screen. Okay, what I have to talk about today is backup care coordination. And we have some information here about backup care coordination. And as soon as I can get some room on my screen here, I'll be able to read it and process it with you. Um, I also have after this, I have an announcement about, or just a reminder to join us for our talk with our director, John Lee, and our Deputy Commissioner Wall, Albert Wall. And if you have an occasion to join us for that, I did send out the join link to everybody's email directly, all of our certified care coordinators, I should say, directly. So we'd really, really love to have you come to that. We'll talk about that in just a second. So backup care coordination, here's the latest and greatest info that we have. As you know, care coordinators need to identify a backup care coordinator, and it's part of an individual care coordinator's certification. SDS will connect that backup to the primary care coordinator's caseloads during a renewal of certification. It's going to happen gradually, in other words. To request access, meaning if you're a backup care coordinator and you're going to request access, the care coordinator contacts provider certification, email the team with folks who should know the care coordinators involved. If there's more than one backup care coordinator, that's okay too. The email needs to tell us to request the backups to have access to your record, identify them in the body of the email, copy them on the email, and tell us about any dates to start and or stop the backup access. So if you're going to be gone for a while, some kind of leave or similar, situation, just tell us what that is. And if you're going to report a change to your backup, document it and let us know. Email DSDS certification at alaska.gov with the information. And if you are a backup care coordinator and you're looking for case records, let me make this a little bit bigger. And I can send this out to us too, or I can just email it. What I'll do is I'll email it to all of our certified care coordinators. So I know I don't have everybody here in this session, and that's okay. But I'll send it out by email so everybody has a copy. So how you locate a record is you go to the consumers chapter. Use the search filters for all case records. Select search and leave the filters blank. And sorry about the little typo there for filters. For specific case records, adjust it if needed. Enter the specific information you're looking for, person, and then select search. And that should bring you the caseload, because we will have set that up so you can have access to it. Okay, so that is a pretty simple, quick and simple vision of a backup care coordinator process. This is available to you right away. And I'm going to go to the questions and see if I can't expand that a little bit and make it so I can see your questions. Does the backup care coordinator have to have access right away, or can they request access as needed? It's not in our Harmony guide yet. It's just going to be an add-on to that, like a job aid. It's not there yet, so keep it with it though. So let's see. What is the best answer to? Do they have to have access right away, or can they request access as needed? From here, it looks like you need to email us to request them to have access to your record. Tell us who they are in the body of the email, copy them, and tell us effective dates for activating or deactivating. So you probably could choose access to, for your backups and just identify that in the email. They don't have to have access right away. What you would do is request access for them. They wouldn't request access, okay? The main care coordinator would do that, okay? So if you have backups, and then if your backup changes, if somebody can't be your backup, then, then you would want to let us know about that too. Do we do this when our backups are acting? The best answer I have for this is you do this before they're acting, so that they can have access to your case records. So before they're in action, you identify them like this. Prior to absences, yes. Mm-hmm. How long does it take for activation? That is a great question. We'll have to ask. I'd have to ask our team. I know that our team is, doing them fast, but exactly how long it takes, I don't know. I have to ask them. What about emergencies? Is there a plan for this? I think that if you tell us about an emergency, if you tell us in the email, we could make that happen. I mean, you should connect with us in the event that you're going to be gone and you're suddenly gone and you haven't done this and you haven't put your backups into this permission status already. Then you could let us know, and we'll do our best to get it done. Question says, how does backup access work with releases of information? Will the care coordinator need to have releases of information in place for the backup care coordinator in advance? Okay, I'm just going to jot that down. So I don't see a piece on here that you have to turn in a release of information. It really is, I'm going to verify it, but it's most likely that you identify, you let the person know who the backup is. The person joins with you as the care coordinator. So they're going to understand at some point you'll have a backup. It is not my understanding that we have to have separate ROIs in place just because, we already know how to handle this information and you're already in Harmony as a care coordinator. So you've already gone through all that. privacy stuff, so I will verify it, but I'm pretty sure that you don't. But let me get back with us. Okay. Is the access automatically done at the time of recertification? It is my understanding that it would be. If the backup is part of the agency, don't they already have access? It's my understanding that they do. They do, because our agencies already have, access to each person's information under the agency. So if your backup is within the agency, it's my understanding that they already have it. Should this be in place as part of the support plan? Um, my best answer to that is, when you communicate with your person that you'll be gone, you do identify your backup. Okay, you communicate to the person in the plan, and you do communicate to the person that, when you're gone, this other individual care coordinator will handle their case. This is just a way to help us hook that together so you can see them if you don't already have access as part of being an agency. If the person I am the backup for is hospitalized, will I be able to complete the same process to get access to their harmony? You mean like the main care coordinator can't do this and they didn't already do this? I think that you should connect with us individually if that happens. If the main care coordinator didn't put this in place and you're the backup and suddenly they're unavailable to do any of that, I would say connect with certification and let us help you with that. That's my best answer right now. Um, since the backup is listed on the support plan, doesn't that imply permissions if needed since the guardian signs the plan? If we need additional ROIs, that would be important to know. Yeah, I'll verify it, okay? But my best answer is that we don't need additional ROIs because you're already in there as a care coordinator, or you already understand how to handle this information. You're right. The person has signed the plan. They understand. It's really normal for any kind of like a medical level of care provider to have somebody who's also a qualified provider be a backup. Our agency obtains an ROI for the backup to be able to see the client's information. That's fine. I'm not saying that's wrong at all. Other questions? I'm actually going to see if I can grab a chat message here and see see if someone can help me with the ROI question. Maybe I can get an answer soon. I don't know. I'll try. Okay. If not, then we can verify for you. What other questions are on your mind here about backup? Any? All right. The person I'm looking for is out of the office, so that's okay. Um, Backup is named in the support plan. I don't see it in a lot of plans I come across. Are backups needed to sign plans too? No. In general, about backup care coordinator, how does the billing work for that? Um, the care coordinator bills the activities that if they end up doing the entire, month's care coordination, they just bill conduit for it. If they do a support plan, they bill conduit for it. Okay, so it's hard because it's a monthly unit, and if you have some kind of an internal arrangement that you make to pay another care coordinator for a few days of service, then that is something that you do. But the activities of care coordination that are in reg that are part of the monthly unit, those are just, it's just a monthly unit. So Conduit will pay any certified care coordinator. They doesn't, the association of the care coordinator to the person is more through SDS. So good questions. I like the questions. What other questions do you have about backup care coordinators? Okay. All right. Different topic here. I don't see any more coming in about backups, but I owe you an answer about how long does it take? And do we need ROIs for the backup? We're obviously not denying plans if we don't see a backup there, because there's another way to do it. And it's more important to do, let's see, important, but the person needs to know about the backup, and that's what's in the plan. But to tell SDS that your backup is that individual, like in the process we're showing, that's important because that'll hook you together with those files in Harmony so that you can see them when you need to see them. Okay. Yes, some care coordinators have multiple backups. Yes, they would all get access as long as you follow the process and allow us to, give them access to your files. It says, so you're saying a care coordinator should request access to our client files in Harmony for our backup CCs? Yes, you should. You should do that. Follow the process on the document that we have showing. And I'll send it to you. Look for it in your email. Yeah, you should do that. And I appreciate the questions about what if it wasn't done and things like that. This was more just kind of coming down to the bigger question was, if I'm a backup, how do I see the files? How do I get the notices, and how do I know what's due? Like how do I see the ticklers and stuff like that? And so we had to come up with a way to associate you within Harmony as a backup. That's why. So we're just, allowing the main care coordinator to tell us, who's your backup. Hmm. Okay. Comment says, I don't know if certification sees it the same way. At my last renewal, they informed me it was only possible to have one backup care coordinator. No, we have a few care coordinators with a couple of backup care coordinators, and it's really situational. So I don't know if, yeah, I would just ask them again. You could follow this process. And if you had more than one, then follow the process. Are we needing to do this as a new thing for those of us who've been in Harmony, or only for new staff going forward? This is a new thing for everybody, as I understand it. How does it work if the backup is in the same organization? Well, we have access to files if we're in the same organization. You can look up client files in the same way, right? So you're already able to see client files in the same organization. Um, you could always, if you have certain people that you want to associate as a backup within the organization, you could send it in. If you have a multiple care coordinator organization, it's my understanding that you can already see the files by looking them up in this way. But, I'll verify. I'll bring that up too so that I can make sure that our CERT people, are clear with me on that. But this is my understanding that for multiple care coordinators, that we already have, it's already possible to look up client files. Hmm. Yeah, just making a note. All right. All right. Okay, cool. I had an unrelated question, I think. For the Unio 4, are we using the PDF form or using the Word doc? For SDS forms, it only has the Word doc. Um, do you mean on the approved program forms page that there's only a Word doc? Okay. Well, I'd have to go check that out. Um, Gosh, that's a good question. See if I can find that. You know, some of the forms and things like that are, I mean, we still have little glitches arising from the website having had the cyber attack and then remedying that. So it may be that, certain browsers or some other answer like that might be part of why we only see certain file types on on the on the approved program forms. But let me take a look at it in one of our common ones, and I will be able to bring that up. If we normally we post PDFs, right? PDFs are the thing. That's like the main thing. Um, I'll show my screen. PDFs are the main, way of having a form, the main format, I should say. So I'm curious about it. I was sort of just looking at that just now too, but of course I have to go back and look again. Yeah, okay. All right. I will ask about that too. Unio 4 just posted as a Word doc. Yeah, good, it's a great question. I appreciate that. I appreciate the opportunity to look into those. I will ask our policy team. Yeah, totally. Okay, what else are you thinking of? I do have our like I said before, our webinar on the 15th for care coordinators to share with John Lee and DC Wall. So you want to come to that if you can. We also have our last CEH hour on the 17th with eMods and home maps. And we're hoping for that to be inclusive, meaning you could share that with people you serve and families if they were so inclined, to come to the webinar, because that's a very general, all inclusive webinar just to discuss home maps and eMods and what, how to think about making a home environment accessible. Okay. All right. Speaking of documents, it's like Uni 14. We still ask for SDS ID or SDS number. Oh, I'll make a note of that too. Um, Cost overview. You can always use the Harmony ID, I think, on that. Um, Cost overviews are also generated out of Harmony when we're going through Harmony processes. So that's the way we're going. So instead of a separate form on our website, will there be a new sign up for 2022? Yeah, we're going to have to end the series here just because it only lets us book so many. And we'll have to send you a new link to sign up for this series, and I'll get that out to you. Yep, we'll get that out to you shortly, the next couple of days or so. All right, comment says, since we have to write a lot of narrative in the Unio 4, Word is preferable because we then just convert it to a PDF once it's complete. That may be or user consensus may be why that's what we posted, but I'll verify that for you. We'd like to prepare solutions to bring to the webinar with Director Lee. What format would you recommend? I think that you should just write us an email. We're asking for your concerns, comments, solutions, suggestions, anything to be sent ahead by December 9th. And if you would please email us at sdstraining@alaska.gov. I only got one comment for that. So I am going to have a consent, the compendium of all those sent to Director Lee, so he's aware of the themes and things like that. So if you could please do that, that would help out so much. Thank you. Since today is the first Tuesday of the month, we're not having our office hours, just this meeting instead. We'll have them on Thursday, though. We'll be there for you on Thursday. Okay. The intention of the meeting. So the intent of the meeting is to find out where we are from people who do the work in terms of care coordination, how to come up with ideas on how SDS could better support care coordinators. There's also a co-occurring study which sort of just started, done by two contractors under the mental health trust. Like, that's how they're starting. And so they're starting to study care coordination and how it's changed over the years, and what could be done better, what we could do to help enhance care coordination, what could we do to grow it, where does it need to be, so they'll come up with recommendations too. So it's quite possible that you may interact with a different study as well. So it's just right now, today, they're two separate things, but it's possible that, I mean, when you see it, it'll go together in your mind, of course. And I get a lot of questions about that, is it the same thing? And what, but Director Lee will he'll talk about that a little bit too. And it's just a listening session so that we can make improvements. It says, can we bring creative ideas for the future or ideas to eliminate redundancy? Absolutely. I'm willing to draft a list of ideas. If people want to email me at Heidi@islandcareservicesllc.com. Yeah. I can hopefully copy your email address and put it in an answer so everyone can have that. Okay, so let's see. I'll do my best here to do that. I'm just going to copy the whole comment and I'm going to paste it and send it to all. And it got nice and big, so it covered up other things, but that's okay. Okay, question says, can extra daily respite be approved on Appendix K, or is it just hourly? I've been under the understanding that any service can be requested beyond the regulatory limit if justified. I was told differently when I requested extra daily respite. I'm wondering if that also applies to Appendix K. The reason for the request is shortage of agency-based staff and only family-directed staff is available. I would have to look at the Appendix K allowances, but I'm of the understanding that it's only hourly respite. So I don't know if you requested that and it was denied. I know that under regular old regs, you can request extra respite. Yeah, I'm not sure if if that was a denial or how that occurred, because it was denied. Okay. if there's a denial, the person always has the ability to pursue fair hearing. I'm sure they gave you the regulatory reason for that denial. It is in my memory banks that the Appendix K flexibilities were related to hourly respite. And the reviewer said there were no room in regulations for exception. Yeah, there. If you go to the respite regs, they probably quoted them to you. And it may be the case that they look at everything together. They look at the whole, the whole scenario. If you needed a better explanation, I would go right to them and or their supervisor, the unit manager, and you could ask for a more clear explanation. And then if it's a denial, then of course the person could bring it to fair hearing if they wish to do so. For Appendix K renewal, is it still only for plans dated prior to April 1st? I do not have updated info about any further extensions regarding Appendix K at this time. So I don't have any updates to those uh, planned expiration dates for Appendix K flexibilities. And usually it's, how it's been going is it kind of comes like sort of kind of last minute, so I wouldn't say that it's not possible, but it may be that it takes a little while for the info to get vetted and sent about. Hmm. I can send the invitation. Yes, I can do that. Let me grab that and I'll put it in an answer here, and I'll just be um, find my GoToWebinar controls. Let's see. I'm looking for it. That's why I look funny as I'm looking at you, but I'm really just searching for it. I'll get that to you. It's easy. And feel free to go ahead and send me your questions as I am searching here. I'll do my best to answer them or at least bring them to people who can help me know the right answer or clarify. Some of us had commented to me that they're still getting things from the GoToWebinar system that has Sina's name, and so of course we miss our colleague Sina Fisher, and of course we wish her the best in her new role. The webinars that she set up, I need to leave them with her name in them, or else they wouldn't have good links. So we're just going to let them ride them out, until we have new classes up. But we're certainly putting up new classes and new webinars. Check our training calendar. We're super excited about the. Oh, actually, you know what? It's a Zoom. That meeting is a Zoom. Let me find that for you. We're super excited about our new learning management system, and it'll be mostly available to care coordinators. We're hoping to put together a whole new training, self-accessed and within our LMS for our care coordinator population, and it's going to be great. And we're still working on it, but we're hoping to build different trainings in there with some of the kind of case management and I guess negotiations / soft skills and all the HAB things and the different trainings that folks have been asking for. So I'm open to suggestions for that too. We're pretty aware of a lot of different trainings that our care coordinators are in need of and have requested. So look for that to come out. Let's see. We also are excited to talk a little bit briefly about uh, Full Lives. Full Lives will be online again this year, and it's in April. And depending on the dates in April, I just want to make sure it's a 3 days in April. And I'm going to find my calendar. Let's see if I can find that for us. April. All right, 14th, 15th, and 16th. Oh, I'm sorry. Wait a minute. I need to find April 2022. Wouldn't that be good? Oh boy. You know how it goes. 13th, 14th, and 15th. So look for those registrations and you'll be able to have your entire for renewal training, you'll be able to have renewal training available to you for completing the full lives, and you'll have you'll have your hours of CEH for the year, 16 hours, I believe, if you also sign up for that. So for both, we'll have it good for both. All right. And so I'm going to copy the invitation link and put it in the chat. And I have to go back and look at your, this is an invitation to register. Okay. So this is a registration. You'll register for it. Just the reason being that it's really helps me to see who all's there and make sure that it's care coordinators. You know, we've done our best to make sure that it's care coordinators only. Please don't share with other provider types. It doesn't mean that we don't love them, because we do. We want to hear from everyone. But this is a special capacity session for care coordinators. All right. Are we going to hire another training team member? Of course we will. Of course we will. So yes. What is Lauren's role? Lauren Scarmuzzi, she is still with our NFLOC team. She's a good contact for plan reviews for NFLOC. And Heather Cord or Kat Sawa is still a good contact for IDD or ISW. Step-by-step training. We need a step-by-step training on goals and objectives that meet reviewers' expectations. Yes, we are working on that. Oh, the link is for the meeting itself, not the registration. Okay. Oops. Hang on. Let me look at it, okay? Let me look for it. Meeting information. Invitation link. Let's see. And you know what? I may have set it so that it's just a join, and I did. And I'm sorry. I'm sorry to be confusing. That's a good link. Don't worry about registration. I remember now. I wanted to make it just a join link so our guest speakers wouldn't have to also register. Zoom is weird. It doesn't do like GoTo does. GoTo lets us give people like a special status where they don't have to register if they're like a panelist, you know. But Zoom is different. It's a little bit I don't know. It just doesn't have that capability, but it's better because it's you know, you can use your camera and stuff, and you can use your audio. All right. Well, so thank you for your patience on that. By the way, it's 1 p.m. to 2:30 time of meeting on December 15th, 1 p.m. to 2:30 p.m. Yeah, we in the past I've had, it really depends on the person, you know. SDS folks are really used to us with our go-to stuff, and I know you are, of course, right? But folks that are outside of our division are more versed in Zoom, and it's a little bit easier. It's just easier for them to just join, and it's hard to I've just had better luck with folks who are super busy and like doing all kinds of things. It's just easier for them to click on a link rather than pre-register. So anyway, we kind of went around and around with that, which is why I'm remembering it different. But you are good. All right, so I'm going to send the time. Full Lives meetings, as I understand, have not started yet. So the Full Lives people, if you're used to working with us for Full Lives, I'm still looking for that to start up. All right. The question that you're asking here, a few years ago, SDS was going to adopt a new assessment tool. Is that still happening? That's a really good question to bring to the meeting. You should bring that or write it to sdstraining@alaska.gov, and then we'll make sure that the presenters know about it. There's a question about who's a good contact for brainstorming residential treatment for a young person with DD and behavioral health. I tried to reach out to Karina Castillo Shepard. She is still the best one to contact. Lacking her, you could try Heather Cord or Kassawa, and they'll be able to. We should be able to give you basic information about that. Mm-hmm. Can care coordinators get certified to provide behavioral health waivers? Well, the behavioral health waivers are not what you think. They're a little bit different than waivers of what we're talking about. I'd have to go onto that website and the behavioral health website and refresh my memory, but it's more so a bucket of services that are paid by Medicaid that are to treat behavioral health conditions, and they're overseen by the treatment person has to work underneath a behavioral health clinician. Okay, so it's really not the same type of thing. There is case management. It's more involved with direct care, I guess is a better way to put it, under the oversight of a clinician. So it's not the same thing as what you're thinking about. TBI waivers, my best understanding is that it's similar to behavioral health in the sense that care coordination is very much involved with, and it's not called care coordination, it's like case management. It's very much involved with teaching and training the person to become more independent from a case manager role, the person and their family. It's more like getting involved with their family. It's not like making a care plan and having other people do it and billing for it. Exactly. It's providing some direct case management. So it's different. It's not the same kind of waiver role that you're thinking of. It's my best answer here is that it's best if you have people who need these services, it's best to put the TBI people on your team, so you can put things together from both the waiver and TBI, the waiver and behavioral health. There are people who, the similar behavioral health services. They could get residential under behavioral health. They could get individual skill development or group skill development, kind of like DayHab, sort of. But it doesn't have separate care coordination like what you're thinking of. Not exactly the same. But I would say to reach out to them and put them on your team if you have somebody with care needs like that. And bringing the person into the waiver, of course, is their developmental disability or their nursing facility level of care, diagnosis and needs for care. Good questions. Mm-hmm. Okay, what else is on your mind? Look for all this. I have on my list to ask about the backup care coordinator. How long does it take? Do we need extra ROIs? Verify my answer of no. And multiple care coordinator agencies, do they have to follow this process, or do they already have backup access? It's my understanding that you did, and that I'm going to say, that you wouldn't have to follow this, but if you did follow it, there wouldn't be anything wrong with that. I don't think that would be wrong. Um, I'll ask about the Word docs. It's probably the case that our users preferred that, because you can just write to your heart's content, and they weren't making spaces in them, little boxes to fit. So pretty sure that's what it is, that they'll probably stay that way. Um, yeah. And look for our new links to our monthly outreach as well. We'll have you register for the year. Pretty sure it lets me do 12 or 16 sessions. I'll figure that out. It changes. Go to webinar is different. It does its thing. For now, I need to leave the meetings that Sina created in place, and you'll probably see her name because she created them as an organizer. So don't worry, it's okay. It's you'll just see her name, although she's not on our team anymore. She's in a new journey and a new adventure. So we'll have different changes and new staff and things like that. So just look for that. And we're here to help you. Delight and Cassandra and I are still here, of course, and we'll do our best. We'll do everything we can to assist you, and keep it going. And our office hours are still there, except for today, the first Tuesday of the month. What other thoughts do you have, or other questions? Contacts for staff, or um, curiosities in your mind? And we can leave 10 minutes early if you want. It's up to you. It's okay. All right, here's an interesting thought. I'm a little concerned about the recommendation a staff member at an ADRC made to a client on the ALI waiver for IDD services. I addressed it with the worker and sent them the SDS brochure with the graph of all the services. I am hopeful it's been resolved, but it's the second time it happened. Does it need to be reported somehow? Uh, Gosh, its comment says I'm muted. I don't show that I'm muted. I hope y'all can hear me okay. ADRC, okay, that's cool. ADRC and DDRC both use the same person-centered intake form. Okay. All right. Hang on. I'm just making the one written response here. Okay, so for the quality stuff, if people don't know something, everybody has a supervisor, right? we're all the same. I'm the same. I don't know things a lot of times, and I'm trying to help and I answer and it's wrong, right? So, you know, if you're concerned and you think the person that's helping needs retraining, it's okay that they use the same PCI form. They're not the person's not. We're just talking about person-centered intake at that point when they're with the ADRC or the DDRC. No, like if I had a developmental disability and I went to the ADRC, they could still help me. They would probably refer me to the DDRC. But that's okay. They could also help the person from their perspective too. So it's really just just an intake. Um, and I have someone in my area that needs ADRC. Can I refer them to DDRC? I don't see why you couldn't. I mean, you could try if that's what you have available to you. Um, I don't know that they use the same intake. Seems like they should know what's available for different waiver types. They have general information about that. They do, but they're really, it's info and referral. They should have the same info that's on the brochure. If somebody there is telling folks that they're possibly going to qualify for ALI waiver and then talking about HAB services, that's a retraining thing. So my best answer here is, for that concern, you can definitely report that to quality assurance. Um, I know it sounds harsh and it doesn't make sense and it's not like, it's like an omni answer, but many times, we take concerns about quality assurance on the CIR/mandatory reporting link. And it's good because it gets logged in and it gets addressed by the right person, so you can do a QA report on that. And you don't have to qualify it as like a big emergency, you don't have to fill out all the forms, and you don't have to identify an alleged perpetrator or whatever the different bands say, the different sections say. You don't have to put that in there. You can skip to it. You can skip to what happened and you can say, this is a QA report. Just type it in there. Tell us what your concern is. Tell us what happened. Tell us that you're worried about it. And, let us help. Let us help our colleagues at ADRC. We can shoot that to the ADRC oversight folks, and they can help to retrain them. And they can just look into it. You'll get a copy of it if you ask for a copy that says it's a protective services report, but we know it's not bad. We're going to see in the report that you wrote it's just a QA, right? So just best answer I have is to use that. It really is not a problem. Um, it's really not a problem. Yeah. All right. It says the individual was on CCMC transitioning to APDD. Okay, cool. But they did not complete the assessment that was due to the client. Okay. So yeah, they have to apply. They need to go through that. They need to go through the ADRC. So, I mean, if there isn't, it, it's my understanding that they can also contact by phone. It's not really, it's just an intake. They could call people. They don't have to go there. They don't have to be in person. So I would just reach out to ADRC or DDRC. And I think for a person who is going to do the APDD waiver, there's no reason why they couldn't use either or, really. So question says, in the past, SDS has tracked care coordinators, percentage of plans submitted timely. Do you have updated info on how we're doing as a group? I've run into some erroneous info in Harmony that may be affecting this data. I do not have that. I'm not prepared with that right now. But I think that you should definitely put that on an email and shoot it to sdstraining@alaska.gov, and we'll bring it up in that meeting. Or if you want action on it, if it's a specific thing, I mean, don't include client info, right? Unless you send me a DSM. There's no generic inbox for DSM for training. You could just send it to me, and I'll just make sure that we get it looked into. Okay, so um, for doing as a group, I would have to go through our research and analysis unit for that. But you should send it, because then we can give John a heads up that that's what we need. And that's what we're, looking at. Like when we hear that, we go, well, in Harmony, it says this. And so what's that all about? I think that you should send me that in SDS training at alaska.gov. Okay. It would be really helpful for our whole team. It says the new QI report doesn't address timeliness on support plans or applications. The same doesn't include CIR timeliness either. Okay. I'll just make a note of it. I'm sorry I don't have a set answer for that right now. I'd have to grab a few people to help me, I'd have to grab a few people to help me get that to you. And so what you're talking about is SDS has assurances to CMS, and we do have we're telling CMS that we're timely, and then we do reporting to CMS because there are, federal oversight and financial, connection to reimbursement for the state. So we want to show them that we're administering the waiver programs in the way that we say we will in our applications to the waiver programs. And some of those things are deadlines like timeliness of reporting under health and safety and timeliness of support plans and that type of thing. So, yeah, yep, that's why we do it. But, we're always open to clarify when these things are usually, I see that too. I mean, I know that I have to, get better versed in all those details, and how when we have a care coordinator, you know, ask us, it doesn't show on this report, but yet you're saying this. It's better. We'd be better prepared if we could draw the line clearly for you. So I know that when I ask for that line, I usually get a good answer. So yeah, I'm happy to prepare our teams to be thinking about that, put something together. Okay, it's coming up to the top of the hour. Um, I want to thank you for spending time with me here and doing what you do. Of course, very proud to be part of the care coordinator support team here at training. Since 2008, it's been the main thing that I do. And I'm excited about more new things to do, and helping more care coordinators come to our big team. And I know that things haven't been as easy, or things have been hard. I'm not going to say that I don't see it. We do see that. We know that we have a lot of challenges in our way, but yet people still have needs for support. And I just think it's great how, our teams work together and care coordinators work together to try to make the best possible outcome for the person. And, we're just here to serve you. So no question is too small, no issue is too out there, and I welcome your creativity too. That makes it fun and relevant. So anyway, that being said, definitely put the meeting on your calendar if you can, and we're going to record it. If you can't be there, is definitely not the last time that you'll have a chance to, let us know what you think is a better improvement, or what you think should start or stop, what would make things better. Um, and you can always email that to us. And that, like I said, that forum isn't the only one. And we will get to other provider types too. So I don't know if you're engaging with other provider types and are like, hey, we didn't get a meeting. Don't worry about it. We're really looking towards, different ways to get to know what's going on with people, and we'll have other plans too. So I don't have anything specific on my calendar, but we can bring that forth. Okay. So we'll see you then, hopefully. And I hope you have the a great afternoon. Yeah. Yep. Thank you, Kimberly. Yay. All right. We'll go ahead and end our session and we'll catch up soon. Okay. Thanks, everybody. Thanks for being great. Bye for now.